Symptoms of early and severe stages of diabetic ketoacidosis. Every year, over 100,000 people are hospitalized due to diabetic ketoacidosis, a severe complication of diabetes. Diabetic ketoacidosis, or DKA, is a critical, untreated condition that can result in coma or even death if not promptly addressed. It's a silent enemy, affecting many people worldwide, and its severity cannot be underestimated. Let's unravel the mystery that is diabetic ketoacidosis. You've probably heard of type 1 and type 2 diabetes, but where does diabetic ketoacidosis fit in? Let's start by painting a broad stroke of what diabetes is. Diabetes, or Diabetes Mellitus in its simplest form, is a condition where your body has trouble managing its blood sugar levels. Now, there are two primary categories of this condition: type 1 and type 2 diabetes. Type 1 diabetes happens when your body's defense system wrongly attacks the cells in your pancreas that make insulin. Insulin is a hormone that assists sugar in entering cells to provide energy. Without sufficient insulin, sugar accumulates in your blood, resulting in high blood sugar levels. On the other hand, type 2 diabetes, the more common type, is a chronic condition that affects the way your body metabolizes sugar. The body either opposes the effects of insulin or fails to produce adequate amounts to regulate glucose levels normally. Now, let's bring diabetic ketoacidosis, or DKA, into the picture. DKA is not a type of diabetes. Instead, it's a severe complication that can happen when your diabetes is out of control. It occurs when your body starts to run out of insulin. Without enough insulin, when your cells can't utilize sugar for energy, your liver starts breaking down fat for fuel, creating acids known as ketones. If too many ketones are made too quickly, these build up in your body, known as DKA. DKA may develop in individuals with both type 1 and type 2 diabetes. However, it's more commonly seen in people with type 1 diabetes. This is because their bodies can't produce insulin at all, making them more susceptible to running out of it. So, while diabetic ketoacidosis can occur in both type 1 and type 2 diabetes, it's more common in type 1. Understanding these distinctions is vital because it helps us recognize the severity of DKA and why it's crucial to manage diabetes effectively to prevent such complications. The symptoms of DKA can develop quickly, sometimes within 24 hours. If left untreated, DKA can lead to severe complications such as cerebral edema, kidney failure, and heart problems. Now that you can see how serious diabetic ketoacidosis is, knowing how to recognize it is essential. Remember, knowledge is power. When it comes to DKA, understanding the condition, its symptoms, and potential risks can be a lifesaver. Early detection can save lives. Learn the warning signs of diabetic ketoacidosis. The first and most common sign is excessive thirst. You might feel like you can't quench your thirst, no matter how much water you drink. This is closely followed by our second sign, frequent urination. These signs indicate your body's attempt to eliminate excess sugar from your bloodstream. The process starts with insufficient insulin, which is essential for glucose to enter cells and supply energy. Inadequate insulin results in the accumulation of glucose in the bloodstream, leading to hyperglycemia. As blood sugar levels rise, the kidneys attempt to remove the excess glucose by excreting it into the urine. This excess glucose in the urine draws water through osmosis, leading to increased urine production, known as polyuria. Consequently, the individual experiences frequent urination. As a result of increased urine output, the body becomes dehydrated, third sign, triggering extreme thirst, known as polydipsia. The excessive loss of fluid through urine exacerbates dehydration, leading to a vicious cycle of thirst and frequent urination. But the enemy is crafty and doesn't stop there. You might start to feel tired, fourth sign, and when your body doesn't have enough insulin to use sugar for energy, it starts using fat instead. But fat isn't as good for energy, so you feel exhausted. Even small things can feel like big chores because your body isn't making enough energy. Also, your blood gets too acidic because of ketones, which makes you feel even more tired and weak. The fifth symptoms on our list is high amounts of ketones in your pee or blood. In diabetic ketoacidosis, DKA, the body's usual way of using sugar for energy is disrupted because there's not enough insulin to help it. So, the body switches to breaking down fat for energy instead. This process makes something called ketones, which are like waste products. Usually, your body can handle a little bit of ketones, but in DKA, there's too much of them because of the severe lack of insulin. When there are too many ketones in your blood, it can become too acidic, which is not suitable for your body. It's like when you have too much garbage, it starts to smell bad and make a mess. In DKA, high levels of ketones in the blood indicate that your body is in a severe situation and needs help. Now, how will I determine if I have too many ketones in urine? The answer is through ketones urine test. A ketones in urine test can be done at home or in a lab. Ketones in urine test are often checked using a spot test, which comes in a kit available at drugstores. These kits contain dipsticks coated with chemicals that interact with ketone bodies. To use it, you dip a dipstick into a urine sample. If the color changes, it means there are ketones present. There are two results you can check: normal and abnormal. An abnormal result means you have ketones in your urine. The findings are usually categorized as small, less than 20 mg/dl, moderate, between 30 and 40 mg/dl, and large, greater than 80 mg/dl. It's important to talk to your doctor if you have abnormal results on your test. Another early symptoms, 6 on our list, is high blood sugar levels, hyperglycemia. In DKA, blood sugar levels soar, typically exceeding 250 milligrams per deciliter. This hyperglycemia occurs due to a lack of insulin, the hormone tasked with carrying glucose from the bloodstream into cells for energy. When there isn't sufficient insulin, glucose increases in the blood, resulting in increased levels of sugar. Now down to our severe symptoms of DKA. Number 1, nausea or vomiting. Nausea and vomiting often occur due to several factors. Firstly, the buildup of acidic ketones in the blood leads to metabolic acidosis. This acidic environment can irritate the lining of the stomach, causing feelings of nausea and triggering vomiting reflexes. Secondly, high blood sugar levels in DKA can cause osmotic shifts, leading to alterations in fluid levels within cells. This disruption can impact how the stomach and intestines work, leading to this symptoms. Number 2, stomach pain. Due to the buildup of acidic ketones in the blood, leads to metabolic acidosis. This acidic environment can irritate the lining of the stomach and intestines, causing abdominal discomfort or pain. Number 3, rapid breathing or shortness of breath. Diabetic ketoacidosis, DKA, can occur due to various physiological mechanisms associated with the condition. Firstly, DKA leads to metabolic acidosis, where the blood becomes too acidic due to the buildup of acidic ketones. This acidic environment triggers a compensatory respiratory response, where the body attempts to remove excess carbon dioxide, CO2, by increasing the rate and depth of breathing. This rapid breathing, known as Kussmaul breathing, helps reduce the blood's acidity by exhaling more CO2. Moreover, DKA often results in dehydration due to excessive urination, leading to electrolyte imbalances and reduced blood volume. Dehydration can affect lung function and lead to respiratory distress, contributing to shortness of breath. Furthermore, high blood sugar levels in DKA can cause osmotic diuresis, leading to fluid loss and dehydration. Dehydration can decrease oxygen delivery to tissues, further exacerbating respiratory symptoms. Additionally, the stress and discomfort associated with DKA, along with symptoms like nausea, vomiting, and abdominal pain, can also contribute to rapid breathing and shortness of breath. Number 4, fruity smelling breath. Fruity smelling breath in diabetic ketoacidosis, DKA, is caused by acidic ketones in the body, particularly acetone. In DKA, when the body doesn't have enough insulin to utilize glucose for energy, substances called ketones, like acetone, acetoacetate, and beta-hydroxybutyrate. When ketone levels become excessively high in the bloodstream, acetone is expelled from the body through breath and urine. As a result, individuals with DKA often have sweet or fruity breath, resembling the odor of overripe fruit or nail polish remover. This distinctive odor is characteristic of DKA and can sometimes be detected before before other symptoms become apparent. The presence of fruity-smelling breath is a warning sign of DKA and should prompt immediate medical attention. Symptoms number 5, decreased alertness. Insulin deficiency impairs glucose utilization, affecting brain energy supply and alertness. Accumulation of acidic ketones induces metabolic acidosis, further impairing brain function. Dehydration exacerbates cognitive dysfunction by reducing cerebral perfusion. Electrolyte imbalances common in DKA also impact brain function. Additionally, symptoms like nausea and pain contribute to decreased alertness. Finally, if left unchecked, diabetic ketoacidosis can lead to confusion or difficulty concentrating. Feeling disoriented or confused in diabetic ketoacidosis, DKA, can result from several factors related to the metabolic imbalances and physiological changes occurring in the body. Firstly, DKA is characterized by severe insulin deficiency, which prevents cells from effectively utilizing glucose for energy. As a result, the brain, which relies heavily on glucose for fuel, may experience an energy shortage, leading to cognitive impairment and confusion. Moreover, the buildup of acidic ketones in the blood can further exacerbate neurological symptoms. Ketones, particularly beta-hydroxybutyrate, can cross the blood-brain barrier and affect brain function. Elevated ketone levels can result in a situation known as ketoacidosis-induced encephalopathy, characterized by confusion, disorientation, and even coma in severe cases. Additionally, dehydration, a common consequence of DKA due to excessive urination, can exacerbate cognitive dysfunction. Dehydration reduces blood volume and impairs cerebral perfusion, affecting brain function and contributing to confusion or disorientation. Furthermore, electrolyte imbalances such as low levels of sodium or potassium, which often accompany DKA, can affect brain function and worsen neurological symptoms. The best way to deal with diabetic ketoacidosis is to prevent it from happening in the first place. Prevention is indeed better than cure. This isn't just a catchy slogan or a wise old saying. It's a principle that holds particularly true when dealing with conditions like diabetic ketoacidosis. Start with regular monitoring of blood sugar levels. Diet plays an instrumental role in preventing it, and let's not forget the importance of regular exercise. By adopting these measures, you're not just preventing diabetic ketoacidosis, but also promoting your overall health. It's like hitting two birds with one stone. Of course, seeking guidance from healthcare professionals who can offer tailored recommendations is advisable. In all, our journey today has taken us through the complexities of diabetes and the early and severe symptoms of diabetic ketoacidosis. But remember, this condition is preventable, and the power to prevent it lies in your hand. Knowledge is power, and staying informed allows you to effectively handle your diabetes and lead a healthy, satisfying life. Remember to subscribe for more diabetes-related content. See you in the next video.